Normally, these exercises can be done very safely and easily by yourself if you're using them for simple stress reduction or releasing tension in your muscles. However, if you're using them to reduce mild trauma symptoms, you should contact a certified provider from traumaprevention.com who will give you a more personal introduction to the exercises with a lot of helpful suggestions and insights on how to perform them safely when working with mild trauma. If you're intending to use these exercises to help recover from any severe trauma, you should only do them in the presence of a clinically trained TRE provider because they can help you know how to use these both safely and in a self-regulated manner.
Exercise number 1. Roll to the sides of your feet. Stretch your ankles. Going side to side, find your rhythm. We'll do this 7 or 8 times each side. And then stop and shake it out. Exercise number 2, Betsy, is heel lift. Going to be working the calf muscle. So step your right foot back. The weight should be in the front foot. Back foot is for balance. Going to lift the front heel off the ground. And you're going to work to your 7 on a scale of 0 to 10. When your calf muscle is fatigued, reaching that 7, stop. Shake out your legs, and then we'll do the other side. Now the right leg. Right foot forward. Lifting the heel up and down off the floor. Working the lower leg, the calf. Find your 7 on a scale of 0 to 10. And stop and shake it out. Kevin, exercise number 3 is working your upper legs. It's working your thighs and your hips. All right, with the right leg back and your left leg forward, you're going to be fatiguing your left leg. Sitting the hips back like you're sitting into a chair, working the weight in your left leg. All right, so the back leg is a kickstand. Come up. Let's try to get the weight back into the hips and the legs. That's it. The knees not coming over the toes. When the fatigue gets to a level 7 on a scale of 0 to 10, you'll stop, shake it out, and do the other side. Good. Hips move back. Very good. Good. Chest is upright. Shake it out and do the other side. Right foot in front, left foot back. Good. Sitting back and coming up. More weight in the right leg than the back leg. When that leg reaches a 7, scale of 0 to 10, stop, shake it out. Nice job. Kathy, we're doing exercise number 4. All right, you're going to be stretching your inner legs and your hips and back. Take your feet wide, a comfortable width where you feel balanced. Fold forward, bending the knees, hands toward the ground. Relax your neck. 3 breaths here. Then walk your hands to your right leg. You can hang on to the leg or the floor. 3 breaths. relaxing the neck any bit. Go over to your other leg, the left leg. 3 breaths. And then move back center. You can reach the hands through the legs. There you go. 3 breaths. After your 3rd breath, bring yourself upright. Hands can go onto the legs. Get your balance. And slowly step your feet together. Shake it out. Amanda, I'd like you to take your feet beyond hip width apart. Going to be opening up the front of the body, stretching the front of the body. Your hands can be at the hips or in your low back. You're going to be bending the knees slightly. You can look down or up. Take 3 breaths as you bow the back slightly. The hips move forward. After your 3rd breath, you're going to turn to your left, rotate the spine looking toward your left elbow. 3 breaths. After your 3rd breath, come center, rotate to the right, 3 breaths. Come back center, 3 breaths. And then come standing. Shake it out. Nice job. All right, Nick, we're going to start with wall sit, exercise number 6. And you're going to go ahead and find the wall behind you and bend the knees and let your back rest against the wall. Now you want your feet a comfortable distance apart and you want to see the tops of your feet. There you go. Good. Now when you sit, you're sitting on where would be a 5 on a scale of 0 to 10. So it's relatively easy. Good. Finding your 5. Now here, you're stimulating the leg muscles in the hip area. You're finding your 5 on a scale of 0 to 10. As it goes up to a 7, I want you to move up an inch. Perfect. Again, as that 5 turns into a 7, you move up the wall another inch, and it's back at a 5. We stay on the wall for 3 to 5 minutes. Traditionally, the tremors come in during this time. It's very normal to feel some shaking. If you're not comfortable with that, you just straighten your knees and come off the wall. Yeah. Now, find yourself back on the wall. Very good. Allowing the shake. We're coming up to that time frame of 3 to 5 minutes. You'll put your hands against the wall. Push off the wall to standing. Bend the knees and allow yourself to hang forward. The knees are lightly bent. The arms can be hanging or fingers on the floor. It's very common for the body to shake, vibrate, and tremor in this position, relaxing your neck. We're here for up to 1 minute. To come out of this, you bring your hands onto your legs and you come up from your hips. Come up slow, easy, and rest your back against the wall if you find you need that support. Exercise number 7, the floor sequence. With your knees bent, feet on the floor, open the knees to our first rest position. The foot soles touch and the heels are close to your body. This is our first rest position. We will demonstrate 2 rest positions. From rest position with knees open, we lift the hips. 1 inch, 2 inch, or just give the intention of lift. We're here for up to a minute. Then you bring your hips down. Rest for a minute with the knees wide. From this rest position, you would bring your knees together 1 inch at a time. Hold that for up to 2 minutes. We do this 3 times, allowing the tremor mechanism to build, the vibration in the body. After the body has movement, we bring the feet flat on the floor, that we can move the feet away from the body 2 or 3 inches and position the knees to the angle that's comfortable for your body. Stop position is when we stretch the legs out and pull the toes back. You can stop at any time during a TRE session. The second rest position are the knees bent, the feet on the floor with the knees touching. You can choose either of the 2 rest positions. From the second rest position, you're here for 1 minute, and then you'll lift the hips for 1 minute. The knees can come slightly apart. After 1 minute, you bring your hips back down and relax, rest. Continuing through the sequence, you bring your feet together and you allow your knees to open 1 inch at a time. Each time you open 1 inch, you're there 2 minutes. Once the body begins to tremor, you go flat foot or maintain this position. You can bring the heels away from your body or move the feet away from each other. Tremoring, 5 to 10 minutes. Anytime you can go to stop. Anytime you can go to your rest position. When your TRE session is complete, you'll bend your knees and you'll roll to your left side. Push yourself up seated and sit comfortably. Observe your body, allow things to integrate.